I went into politics having had nothing to do with it before, never voted, and no interest whatsoever, because I was fed up of how politics had sort of failed many of us. In the veterans care sector, in the services, it's very big. But I think sometimes, almost there's no greater example of that, really, than when it comes to mental health, right? Something that affects so many of us. What are we doing in Plymouth? The debate is changing. When I came in 2014, 2015, I sat down with Kalichi Noam, who was then the head of public health, and we talked about something called the Trieste model, which is something they brought in Italy, where they reconfigured totally their mental health systems to apply sort of early intervention, mass market, if you like, treatments that could reach so many more people before they became really poorly. And why could we not do that in Plymouth? Why could we not revolutionise our healthcare? And from that conversation and working with the city council, and there's some really able people in there, and some, with open minds who really want to tackle this problem. We do have, initially it was 4 health and wellbeing hubs planned to be set up. This week, it's going to be 10. Health and wellbeing hubs will completely change the way we do healthcare in the city, where you can go and yes, you can see the doctor, you can pick up your prescription, but you can go to the job centre and talk about your social security. You can do your course of CBT, and actually we can intervene with people much earlier before they get really poorly and go to places like Glenbourne and cost a lot of money, and you can then reach so many more people as well. I'm really excited this is happening in Plymouth. It's got almost nothing to do with cross-party working and so on. That's fine. As far as I'm concerned, all parties of all colours over the years have completely failed on this singular challenge. And so, I'm happy to work with anybody to achieve that desired end state. I'm determined to deliver health and wellbeing hubs in Plymouth because it will fundamentally change the debate. But ultimately, we're not going to solve this unless people like me come along to days like today, which is why I really wanted to come. Right? I can't do my job. I'm no expert. I don't have a medical background. I can't do my job unless people like you tell me what it is like going through that process. Ultimately, politicians and leaders and commissioners can say whatever they like, but it's how it feels going through that system. It's the same with mental health. It's the same with veterans care and all these different things. And until we get that right, and our mental health community feel that they have that parity of esteem, talking about it, whether it's in Parliament, on telly, whether it's the Prime Minister or the leader of the council, doesn't mean anything unless it actually feels that way for people who are going through the system. I'm afraid, this is one of my 4 headlines, why I became an MP, young people, veterans care, Plymouth and mental health, and I'm determined we are going to deliver on it. You're not going to please everybody all the time. I remember one of my first efforts to do this spectacularly failed when I found that there were lots of mental health charities in Plymouth, and lots of them do a brilliant job. Did they want to work together and reduce duplication? Because I'm ruthlessly committed to how it feels for our people going through the system. No, they didn't at that time. Okay, so it is an inherent challenge, but I'm determined we will get there. Health and wellbeing hubs by 2020, the first one's being set up this year. That will fundamentally change it. So there is hope. People like me get it. Yes, I'm not a clinician, but I do have this burning drive around mental health. The idea that you don't understand it because it hasn't happened to you or somebody you know or care for is simply not good enough, and does not, is not a mark of an advanced society that we claim to be. So I will keep going. We will get a better service for it. But tell us your experiences and be realistic, but be honest about it as well. There's no point moaning about what's sort of happened in the past. I totally accept what has gone on has been extremely poor around mental health provision. That's why I'm here. That's why I left a career that I really enjoyed in the army to a career in politics, which isn't always great fun, because we've got to change this, and we will if we work together. The strength is if we work together. If you tell us how it feels. Okay, and if we go to London and we make sure that happens by doing what we can.